So I don't have any special talents, nor do I have any hobbies that I'm interested in. But one thing that I do have is diabetes, and I would like to tell you a little bit about it. Diabetes is when the blood glucose or your sugar levels are too high in the body for long periods of time, and it causes damage to your body. More than 30 million people in the United States have diabetes, but 1 in 4 are undiagnosed and have no idea, which brings it about to 24% of people who are undiagnosed and walking around today with diabetes. There are 3 types of diabetes. You have your type 1, your type 2, and your gestational diabetes. Type 1 diabetes occurs when the pancreas is no longer producing insulin due to damage to cells. It is usually diagnosed in children or teens at a very young age. It can occur later in life, but it is not common. The most common type of diabetes is type 2 diabetes. It occurs when the insulin is not being produced enough in the body. It can develop at any age. It is more common in middle-aged and older people, and quite honestly, it's very common in obese people. The third type is gestational diabetes. It develops in some pregnant women, but tends to go away after childbirth. It can, however, increase the probability of a woman getting type 2 diabetes later in life. Unfortunately, it's something that can't be avoided when they get it. It can be treated with diet, or sometimes pregnant women have to go on insulin for short periods of time and to keep their blood sugars low, to keep from damaging the baby's organs as well as her own. There are many health problems associated with diabetes. Number 1 is going to be heart disease and stroke. Another problem is kidney disease. Because of high glucose levels, it causes damage to the kidneys, and it can cause women to go on, or men also, to go on dialysis and possibly need kidney transplants. Eye problems are a big issue. I personally have known a couple of people who have gone blind due to juvenile diabetes, and their blood sugars were not under control for so long that it actually causes blindness. Dental disease is another problem. Nerve damage. Neuropathy is a big problem with diabetics. It is usually in the feet. It can occur in the hands, but it tends to be more in the toes, and it causes damage to the point where you don't feel if you have a sore or a cut on your foot, which in turn causes foot problems. With high levels of blood sugar, you're more susceptible to having ulcers to develop because of these cuts and the nerve damage, and it can cause you to lose your foot or your leg in the process. There are several ways to manage diabetes. Number 1 is always going to be diet and exercise. If you can keep your diet under control and keep your carbs down and your blood sugars down, you can live a very long life without any problems with diabetes. Another way most people have to go is through oral medications or insulin. In my case, I personally take oral medicines, insulin, and another medicine that is a shot that goes with my insulin to help boost it, to keep my blood sugars under control. I'm trying to avoid mealtime insulin at this time, but it will eventually come down to that. But that is also because I am the worst diabetic in the world, and I have a bad problem with not following my diabetic diet. I like my sweets, and that's a problem that I have. So if you think you have diabetes, or it's a possibility, I left the website where I got my information from on the work here. Also, always consult a doctor. If you feel like there's something wrong, go to your doctor. Ask every single possible question, even if you think it's a dumb question, to get any information you possibly can to make sure that you don't go undiagnosed for a long period of time before you find out that you're diabetic. This can cause long-term damage to your body, and if you manage to get it under control before then, you can have a very long life and live with it for a very long time.